Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, detecting COVID-19 can be easier and faster. The Food and Drug Administration approves 5 new rapid test kits, but with caution. FDA Director General Eric Domingo tells us more live. Filipino architects join forces to design emergency quarantine facilities. It's a move to address the rapid increase of COVID-19 cases. We'll speak to architect Denise de Castro later on the show. Want to share experiences on the pandemic? Veteran screenwriter Ricky Lee helps us tell stories. President Rodrigo Duterte updated the nation late last night on how the government is addressing COVID-19. The weekly report is required under the new Bayanihan Heal as One law. Mr. Duterte says 200 billion pesos has been set aside for the poorest of the poor. He urged the private sector to help amid these challenging times. He also promised a recovery package for small businesses. Here's the president in his own words.
They have also contributed to our prosperity in one way or the other. So let us support them in this crisis. We implore employers to do their part in protecting the welfare of the millions of Filipino households that belong to the formal sector and depend on their employers for continuous livelihood.
The Food and Drug Administration greenlights 5 rapid antibody test kits. As the name implies, these test kits can give COVID-19 results sooner, within hours or even minutes. However, samples still need confirmatory testing to avoid a false positive or false negative result. The regulatory body warns that a false positive result happens when there is a cross-reaction with other bacteria or viruses. And to tell us more about this, we have on the line FDA Director General Eric Domingo. Director General, welcome to the show, sir.
Hi, good morning, Pinky. Good morning, everybody.
Good morning to you, sir, and I hope you're well. So, Director General, there are 5 new drug tests, rapid drug tests that have been approved by the FDA. I just want to first find out, where are these from, these 5 new rapid drug tests?
The 5 antibody tests that are approved, 4 are made in China and 1 is from Singapore. They have certificate of registration in those countries and they are being allowed to be marketed and used widely in those countries and have been tested.
Director General, how accurate are these test kits?
Well, if you look at the sensitivity and specificity, the accuracy is about maybe anywhere from 85% to 95%. So you still have that window, 15%.
Director General.
Or you might, yeah, hi, Pinky. When you look at the tests,
I must have lost my line to FDA Director General Eric Domingo. We're talking about the 5 new test kits that have been approved by the FDA. These are test kits that could give us results within hours or even minutes. I seem to have lost him on the line because I can't hear him at the moment. So what I'm going to do is I'll first go on a break. I will be right back. course, and still on the line, Food and Drug Administration Director General Eric Domingo. Director General, welcome back to the show. We were talking about 5 rapid tests that have been approved by the FDA, and I think you were telling me that 4 are from China and 1 is from Singapore. Is that correct, sir?
Yes, we have 4 from China and then 1 for Singapore that are registered and allowed for use there. Now, when you look at the accuracy, you can see that the sensitivity and specificity
Manong,
are from 85%
quiet lang
to
kasi para marinig.
90s. So there's still that possibility of false negatives or false positives. That's why we're asking everybody to use them very, very conscientiously and wisely, and they have to be interpreted in the proper context by a physician.
Okay, I'm sorry, sir. I'll have to tell you that I lost a part of it because I was hearing some of the people in the studio. So you were saying that this is not very accurate from what I caught, and that this could possibly give you a false positive or false negative result. Is that correct, sir?
Yeah, that's correct. So it has to be taken into context. A doctor has to interpret the results and tell the patient what they mean, and the PCR-based test is still required.
Okay, so you do that, and then you still have the PCR confirmatory test that needs to be followed up. But run me through the process, Director General, first, on how a person can actually undergo or do this rapid test kits. Do they go to a hospital? Do they go to a clinic? Do they buy it themselves? How does the process go?
Well, you cannot do it yourself. No, you cannot buy it without a prescription and then do it yourself at home. You have to go to a clinic or maybe a hospital or maybe the local government unit, the barangay health center or a rural health unit where they can do it. And then after the test is done, the doctor will have to explain to you exactly what your results are and what they mean and give you some advice on what to do after. It's not like if you're negative, you can just go around and don't quarantine yourself anymore. A lot of care still has to be taken even after the test results are in.
Okay, so from my understanding, Director General, this is different from the usual kits that are being done and conducted by the RITM as well as some of the subnational laboratories, because this rapid test kit, blood is drawn from you, well, very different from what we've gotten used to, where they take a swab of your, well, a part of your nose or your throat, right? Ito, they draw blood. Is that correct, sir?
Yeah, this one, they draw blood. The usual test kits, the PCR test, they look for the virus. So when you detect it, then you're sure that it's really the coronavirus. For the rapid test kits, they check for antibodies that your body produces against the infection. So it's not a direct identification of the virus. So it's possible, for example, that you get infected but you don't have antibodies yet. So you might have an infection, but the test will be negative. In the same way, sometimes it detects antibodies that are made because you've had an infection to other viruses or bacteria before. So that would be positive even if you don't have the virus in your body. So this has to be taken really very, very carefully. Only in contexts where there's a high probability, for example, of testing positive, then it would be very, very useful.
So, because we're not 100% sure of the results of this rapid test kit, Director General, why would one have to undergo or go through these test kits to begin with?
Well, there are some situations, for example, in a hospital where there are a lot of patients that are really symptomatic. However, there's no way for them to have them tested with PCR-based kits very, very quickly. Then this can be very useful tools. Or for example, in a community where you suspect a lot of infection going on, but you cannot test everybody with a PCR-based test, then maybe this can give you an idea of how widely the infection is spreading. And even for patients who are already positive and you just want to know if they're getting better and that they have antibodies already, then this might be useful instead of waiting for another test to show that they're negative. So there are very specific contexts where this can be used. And, that's why we want a doctor to supervise them.
Okay. So that's the thing, sir. Again, for those who may have to undergo this is not 100% efficient or accurate, sir. It still has to go through the confirmatory. I wanted to find out, Director General, when somebody goes through this, what does the doctor say? Does the doctor say you're positive or you're negative or in doubt? How do they actually interpret your results for you?
Well, for example, if you're negative, they say, okay, the test is negative, but of course, you still have to make sure that you quarantine for the next 10 days, 14 days, because it's possible that you had an infection, just you're not showing any antibodies yet. If it's positive, then the most probable next step would be to have the patient undergo a confirmatory test, just to confirm that the antibodies that are formed are due to the virus. So that means you will have to undergo a PCR-based test.
So the ones that are positive will have to undergo the confirmatory test. The ones that are negative may have to just undergo quarantine for the meantime, another 10 or 14 days, sir. Is that correct?
Yeah, well, yes, basically, unless the negative test is in a person that is very, very suspicious to have COVID. If that patient has really severe symptoms, has all the exposure, and the test is negative, then that person will also need to undergo a confirmatory test to detect the virus, just to make sure.
Got it, sir. And how long does the result, before the result actually comes out with this rapid test kit, sir?
Oh, the rapid test kits are really very rapid. No? They take maybe 10 to 15 minutes, and then you get that result that you have to interpret.
But I just want to add one thing, sir. There's also another kit, I believe, that the FDA approved. Isn't this the one coming from the United States where the U.S. also approved this? It's also some sort of a rapid test kit?
Yes, this is a very special one. No? The Gene Expert Test Kit actually tests for the virus, and it does it in maybe 15 to 20 minutes. And the good thing is we have the machines for this because it's the exact same machine that we use to detect multiple drug-resistant TB. So we're now in contact with the manufacturer of the Gene Expert cartridges for COVID. And we hope that, in the next few weeks...
All right, I think
or maybe
we
the
lost
next
Director
month.
General again on the line. I'd like to thank him just the same. That's Director General of the Food and Drug Administration, Eric Domingo. We'd like to thank him for that again. He was telling us that 5 rapid test kits have been approved by the FDA. Welcome back to The Source. Hospitals worldwide are overwhelmed. More facilities are needed to care for and isolate patients. A group of Pinoy architects is heeding the urgent cry in the way that they know best. They've designed an emergency quarantine facility that can house persons under investigation, or PUIs. The design is easy to build and it's affordable. Let's go straight to the source of the story. We have Denise de Castro. She's the principal architect of the emergency quarantine facility and of the DECA Design Collaborative. Architect de Castro, welcome to the show. Thank you for joining us.
Morning, Pinky. Morning, everyone.
Good morning. A number of hospitals have actually reached their full capacity here in the country in admitting COVID patients. So you and your co-architects have thought of a plan to build a quarantine facility designed for PUIs and PUMs. Can you tell us more about the design of this quarantine facility?
Yes, the design was actually spearheaded by William T. of WTA, based on a pavilion that he did for the Anthology Festival earlier this year in February. And he redesigned the pavilion using wood members and polyethylene sheets, and then also collaborated with other architects and hospital architects in particular and doctors to make it a quarantine facility for our COVID PUIs and confirmed positive patients. And so now he has open sourced that design.
And confirmed.
And he has also asked for volunteers from architects and engineers in the country. And me and my team have volunteered to redesign and build the one here at our ITM.
Okay, but I want to talk about first the first location of this quarantine facility. This is supposed to be, it should be done anytime soon, and it's located in Fort Bonifacio. Where exactly, architect, is this located?
Yes, it's at the Manila Naval Hospital in the Philippine Navy headquarters in Fort Bonifacio. And it's going to be turned over today. The construction has taken 5 days. And we should be seeing more photos of that being posted by architect William this evening and this afternoon.
That's supposed to be finished today. How big is it?
The facility that they have is 6 meters by 26 meters long. And that's the standard size of the design that's been open sourced.
And how many beds? What is the bed capacity of that?
For the one at the Manila Naval Hospital, that's 15 beds.
15 beds. Okay. Now I want to go to where you are. I'm assuming you're at somewhere in RITM right now for the second location.
Yeah.
Am I correct?
Yes, that's correct. Here at RITM, because it's such a
Okay.
critical center, we are building 4 of these facilities.
4 different facilities in front of RITM. So it's going to be the second, the third, the fourth, and the fifth location. Please tell us what's happening at that very moment, at this very moment where you are right now, where you're building the second facility.
Okay. This facility that we're starting to build here is a combination of 2 units side by side because we were not able to put them separate. So now we have a total of 27 beds in the one that we're building here in the basketball court of RITM. The next 2 will be built in front of the emergency room, but they are going to be used for COVID positive patients because RITM, as everyone knows, has their testing facilities separate. So only those positive patients will be cared for in these facilities here at RITM.
And Architect De Castro, when do you intend to finish that one that you're doing right now at RITM?
All the facilities are meant to be built in a short period of time, from 3 to 5 days. So we hope to finish this first one within the week and then start on the 3rd and 4th facilities here at RITM after that.
I needed to ask you though, how safe is this facility? And how are the patients going to be separated from one another?
Pinky, we are working with the doctors here at RITM, specifically Dr. Tabora. She's the head of the Infection Prevention and Control Committee, and they have given their feedback in regards to the design to meet their standards, as well as the DOH standards, WHO standards, as well as the CDC. So we are building it in accordance to their requirements. And what they've asked for in this facility is a 2-meter distance between each patient, with a division between each one.
I think we lost Architect Denise de Castro again on the line. We are having a number of technical difficulties right now, so if I'm still on air, I'm going to try to reset and get back to Architect De Castro as soon as possible. Welcome back to The Source. We still have Architect Denise de Castro.
Hi, Pinky.
Architect, we're running out of time. Can you... All right, hi. Welcome back. We're running out of time, as I mentioned a while ago. Just give us a sense of, what will happen in the next couple of days. Just final words from you and your co-architects on doing this quarantine facility. Denise, go ahead, please.
Okay, so our whole team, mixed of architects and engineers and other volunteers, we have now fundraised for 22 sites, um, mostly in Metro Manila, but all the way also down to Batangas. We have 2 sites there. We are collating the next batch of hospitals that are requesting for these emergency quarantine facilities. And we have opened up funding for these new hospitals. And we will be requesting for materials and monetary donations from all those who would like to help. Thank you.
Architect Denise de Castro, we'd like to thank you, and together with your co-architects for doing this. Very excited to see the end result. And I know that more or less this costs about 350,000 pesos, well, more or less, for this kind of quarantine facility. Again, to you, thank you so much for joining us. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.